a wonderful opportunity to talk in front of you and present my case in front of you. Today, I want to present one of my case of peptic ulcer. Now, I request sir to share the presentation of case that is acid peptic disease.
Okay, I will share immediately, Dr. Sonali. Before that, those who have just joined, let me remind them that this webinar is consist of 3 sessions, the 2 emerging homeopath and 1 very experienced, very humble, very senior homeopath, Dr. Larisa Sol from Ukraine. We are really happy to have all these 3 here. So let's begin first session, approximately 25 to 30 minutes. Then second session, approximately again 25 to 30 minutes. And the last session by Dr. Larisa Hutsol. Okay. So please, let's start the first session. I'm sharing the screen.
Okay. Let's start with the case. This is a case of acid peptic disease. 40 years female suffering from acid peptic disease since 1 year.
Okay.
Next slide, sir, please.
Yeah, just a minute. I'm making it full screen.
Yes.
Okay. I hope you can see this clearly.
Okay, next slide, sir.
Yes.
40 years female suffering from the acid peptic disease since 1 year. The patient had undergone the investigations, that is endoscopy, which shows the GERD, that is gastroesophageal reflux disease. All stomach shows the erythema with acid peptic disease. Next slide, sir. Here we can see the endoscopy reports of the patient, in which fundus, body and antrum of the stomach shows the erythema.
Okay.
Next slide, sir.
Yes, it is clearly visible. So all participants, you can see GERD with peptic disease and erythema, not only in fundus, but fundus, body, antrum, pylorus, everywhere. Okay, please continue.
Okay. The chief complaints of the patients are: patient is suffering from the chronic constipation, acidity since 15 years, which is increased since 1 year. Then pain in abdomen on and off since 1 year, vomiting since 1 year, and sleeplessness since 1 year.
Okay.
I have reported all the chief complaints in detailed manner, that is location, sensation, and modalities. We see one by one the chief complaints. Next slide, sir.
Yes.
The main complaint is acidity since 15 years and increase since 1 year. The patient had burning pain in abdomen, fullness of abdomen, regurgitation of food, and sour taste in the mouth. The patient gets aggravated by disturbed sleep after eating and 10 to 12 p.m. These 3 modalities are very marked. Then aggravated by the spicy non-veg food, farinaceous food, and sour, roti, stress, and constipation. Then next, going to the ameliorating factors. Next slide, sir.
Yes.
The ameliorating factors are: patient gets better by cold water, by cold milk, ice cream, and sleep. Then second complaint was pain in abdomen, pain in epigastric region, left hypochondriac region, and fullness of the stomach. Abdomen is very sensitive to touch and burning colic pain, which gets aggravated by eating and spicy food, non-veg, if no vomiting, and better by heart pressure and after vomiting. Then third complaint was very marked, which is vomiting since 1 year. Patient had vomiting of the food, vomiting after 1 to 2 hours after eating, and sour taste in the mouth, which gets mainly aggravated by the sour, bread, and farinaceous food. Then spicy 10 to 12 p.m. and evening 8 p.m. after, which gets better by vomiting and empty stomach, sleep, and cold milk. Then patient is suffering from also chronic constipation, having hard stools, unsatisfactory stools, and better by eating banana.
Okay, I'll we will take one short, discussion here. Already we are reaching 30, almost 30 people here. So, Sonali, please correct me. So this lady is suffering from 1 year, right?
Yes, sir.
Okay. And her main complaint is?
Her main complaint is mainly affecting is vomiting since 1 year and pain in abdomen and acidity.
So all attendees, you can imagine a 40 years old lady suffering from not 1 day, not 2 day, but 1 long year. And that too on daily basis. So much so that she has done her investigations also, that was also clearly visible. Then she was having constipation, right?
Yes.
And she has vomiting. What is the frequency of vomiting she had?
Vomiting. There was daily vomiting after
Daily
eating.
vomiting.
Daily vomiting after
Okay.
eating anything. In
Okay.
morning also 10 to 12 p.m. and at the evening also.
So what
After
treatment
8
she is
p.m.
taking for this?
She was taking allopathic treatment, taking antacids, I think 3 to 4 antacids per day, and taking painkillers.
Okay. So everyone, I hope you have understood the case. A 40 years old lady with multiple complaints. Most concerning is daily vomiting with lot of antacid, and report also showing the pathological changes. Let's go again to the presentation. Sonali, can you see the presentation?
Yes, sir.
Okay.
Next slide, sir. Now coming to the family history of the patient. Mother is suffering from the hypertension and father is alcoholic who is expired.
Okay.
Now coming back to the personal history of the patient. Here, desire, aversion and food aggravation are marked. Desire for sweet, cold things, curd, milk, vegetables and fruits. Patient has the aversion for fat, pungent, non-veg and tea, and food aggravation from bread, which causes the fullness of the abdomen and acidity. Okay. Patient is thermally hot.
But only a few years.
Okay. Please continue.
Next one, sir. Yes, sir. Perspiration, which is profuse during eating, and sleeplessness. Next slide, sir.
You have told thermals?
Yes, patient is thermally hot.
Okay. Physical
Yes.
generals are in front of you.
Physical generals, yes. Physical generals are head, occasionally headache, aggravation before vomiting, and better by vomiting. There is a dryness of nose and dryness of mouth. Patient feels thirsty at night.
Okay. Okay, so I'm again interrupting. There are many Marathi and Hindi speaking people. So for them, so ये जो ladies है, I think 40 साल की है, कई सालों से गैस्ट्रिक ट्रबल से है. So आज के जो केसेस है वो हमने गैस्ट्रिक के ही रखे हैं, both cases, okay? And this ये पेशेंट को 1 साल से लगभग रोज, सोनाली करेक्ट मी इफ आई एम रॉन्ग, लगभग
Yes.
रोज वॉमिटिंग हो रही है. उसके लिए उसने बहुत सारे चेकअप भी किए हैं, गैस्ट्रोस्कोपी भी किए हैं, और उसमें चेंजेस दिखाई दे रहे हैं, और वो एलोपैथिक टैबलेट्स भी ले रही है डेली. ओके. तो जैसा कि आप देख रहे हैं, क्लासिकल होम्योपैथिक प्रोटोकॉल से डॉक्टर सोनाली ने मेटिकुलसली केस लिए हैं. जैसे पैथोलॉजी चीफ कंप्लेंट में डिटेल्स में लिया है, डिजायर, एवर्जन. एंड अभी आप हमें समझाओ, प्लीज एक्सप्लेन अस नाउ व्हाट इज हर स्टेट ऑफ माइंड. प्लीज गो अहेड.
I have taken the mind of the patient in two formats. First is the childhood history. Let us understand the family condition of the patient. She was of a calm nature and less talkative. She couldn't express her feelings with anyone. Patient had poor economical condition and struggling in childhood. She is elder sister in her family and has a younger brother. The responsibility of brother was on her. She had to do daily work of home along with the studies and taking care of brother because of her mother had to go out for work. Her father is alcoholic, and because of that she has to struggle in the childhood a lot. This is how her childhood was. Then coming to the present condition of the patient. Next slide, sir. Now let's see the present condition of her family. She is from Christian community. There are 4 members in her family. She had 1 son and 1 daughter. Her husband is a laborer. She is taciturn. When she becomes angry, remains quiet, cannot express her anger or her feelings with others. But she has one friend and she shares everything with her. Mainly, she had anxiety about her son because he is also alcoholic and does not do any work. She told me that she goes in son's room every night and checks whether he is sleeping or not. If he awakes, she can't sleep. When his son sleeps, then only then she can sleep properly. She prays to the God every time about the son. She weeps easily and feels better by weeping. This is how the patient's family condition at the present.
Okay, you have explained it in very simple yet effective manner. Any attendee? Have you understood the case? Do you have any question about the case? Have you understood the seriousness, severity, and depth of the case? I want you to be a little bit active in chat box because this should not be the one-way communication. Yes, good. Answer is from Shembekar madam. Hello, Radhika madam. Happy to see you here. Pranjal, welcome. Yes, Divya, Shilpa Patil madam. Yes, happy to see you all. Fabulous females here taking advantage of this webinar. Welcome once again. Be attentive. Okay, Yashasvi, Katrina, Nikita, welcome. Okay, Dr. Mauli. So, can you explain in Marathi or Hindi, like in one or two sentences? Dr. Sonali?
Yes, sir.
Can you explain in Marathi one or two sentences about this patient?
Yes, sir. हा पेशंट जो आहे त्याचे फॅमिली मेंबर्स जे आहेत जे 4 आहेत आणि त्यांची फायनान्शियल कंडिशन ही खूपच म्हणजे गरीब आहे. हजबंड लेबर आहेत आणि पेशंटला त्यांच्या मुलाबद्दल जास्त काळजी वाटते. पेशंटचा मुलगा पण आहे तो अल्कोहोलिक आहे आणि काहीही काम करत नाही. मग पेशंटला त्या आपल्या मुलाची एवढी काळजी वाटते की डेली त्यांना आपल्या मुलाच्या रूम मध्ये जाऊन चेक करतात की मुलगा झोपलाय की नाही. ऍटलिस्ट 8 to 10 टाइम्स एव्हरी नाईट शी चेक्स. जर मुलगा झोपला असेल तर त्या झोपू शकतात, नाहीतर त्यांना झोप येत नाही. इतकी सिव्हिअर म्हणजे मदरली फिलिंग आपण म्हणू शकतो की काळजी जी म्हणतो आपण एवढी सिव्हिअर नेचरची आहे. त्याच्यामुळे त्यांना डिस्टर्ब स्लीपचा खूप प्रॉब्लेम आहे बिकॉज ऑफ एन्झायटी ऑफ द सन.
Okay. So everyone, I hope you have got the important points of the case, and this is how we actually proceed. What is this, Sonali, next?
Follow-up of the patient
Okay.
after giving the medicine.
Yes. Okay. It's fantastic that you have recorded video also. So for everyone, pay attention. This is in Marathi. We will play completely once, and then after we will translate. Pay attention. I think Sonali, this video is not playing, but don't worry at all. I have different one. Is it visible? Hello, everyone. My screen is visible?
No.
No? Just a minute. Now please check.
Yes, sir.
Yes,
It's
sir.
visible.
Yes. Okay, so I'll quickly play it. Everybody, please observe the body language.
बर. पोट साफ होते का आता?
हा होते ना.
बर. झोपेचं कसं?
हाय
झोप लागते.
झोपल्यानंतर नाही जरा सुचते बरं.
हा बर.
जरा सुचते.
ठीक आहे. पोटात दुखायचं प्रमाण कसं?
नाही मॅडम माझ्या पोटात दुखल्या नाही.
अरे वा, चांगली गोष्ट आहे.
दुखल्या नाही. ताईंना मी काल सांगितलं पण आज इथं कसं मला असं पोट लावू देत नव्हतं, काहीच नाही बघा दुखल्या, जरा दुखल्या नाही.
बर. उलटी वगैरे काही झाली
नाही
का?
नाही
उलटी पण झाली
नाही.
नाही. हं? ठीक आहे. डोकेदुखीचं काय?
डोकं अजिबात दुखलेलं नाही.
बर.
मला म्हणजे भरपूरच फरक पडलाय मॅडम.
हा हा हा.
एवढंच की जेवल्यानंतर फक्त इथं
हा.
गच्च होते
हा.
आणि जरा उगाच जळजळते, लय नाही पहिल्यासारखं नाही.
बर. ठीक आहे. हं? चालेल. आधीचा तुमचा त्रास कसा होता?
जास्त होता ना.
हा.
जास्त म्हणजे मला असं गोळी नाही खाल्ली नसले तर
हा.
मला गोळ्यावानी व्हायचं.
बर.
आता म्हणजे हे औषध घेतल्यापासून मला एक दिवस गोळीची गरज लागली नाही.
बर.
असं झालं.
हा. ठीक आहे. ठीक आहे. काळजी टेन्शनचं कसं वाटतं ह्या 8 दिवसात? कसं
जरा
वाटतं
कमी
तुम्हाला?
वाटते ना.
कमी वाटते.
आणि ते व्हिडिओ आलेलाच नाही बघा मॅडम मला. तुम्ही पाठवलेलं का नाही
हा.
तर व्हिडिओ आलेलाच.
ठीक आहे. हं?
Okay, so I will quickly translate for you.
बर. पोट साफ होते का आता?
हा.
So the first question she asked whether you are any improvement in stool. So she is saying yes, stools are better now.
बर.
Note that she had a lot of constipation previously, right?
बर. पोट साफ होते का आता?
हा होते ना.
बर. झोपेचं कसं आहे?
आहे झोपला.
झोप.
See, she has asked open-ended question. Don't ask whether your sleep is better. How is your sleep? झोपेचं कसं आहे? So it is up to her whether she can answer that no, my sleep is not improved. No, my sleep is as it is. Now what she is saying is her sleep is also better.
लागते. हं?
झोपल्यानंतर नाही जरा सुचते बघा.
हा. बर.
She's complaining some
ठीक आहे.
swelling.
हं?
Yes.
पोटात दुखायचं प्रमाण कसं?
So now Sonali is asking about changes in abdominal pain.
नाही मॅडम माझ्या पोटातून दुखलेलं नाही.
So she is saying that there is no pains at all. That's really great because 1 year she was suffering from pains.
चांगली गोष्ट आहे.
ताईंना मी काल सांगितलं
हा.
पण अजून इथं कसं मला
हा.
असं बोट लावू देत
हा.
नव्हतं काहीच नाही बघा दुखलेलं, जरा दुखलेलं नाही.
बर. उलटी वगैरे काही झाली
नाही
का?
नाही
उलटी पण झाली
नाही.
नाही. हं? ठीक आहे.
Vomiting is also not there. There is some pains like sensation here. So see, she was suffering from 1 year. If she would have said that my all complaints are clear, then it is really doubtful. Healthy follow-up doesn't goes from 100 to 0. It comes down and then goes.
डोकेदुखीचं काय?
डोका
Next question is about headache. Headache is also not there.
पण दुखलेलं नाही.
बर.
मला म्हणजे भरपूरच फरक पडलाय मॅडम.
हा हा
So
हा.
it's really happy to see smile on her face. She is saying that I'm really much better. Okay.
त्यानंतर फक्त इथं
हा.
गच्च होते
हा.
आणि जरा उगाच जळजळते, लय नाही पहिल्यासारखं नाही.
बर. ठीक आहे. हं? चालेल. आधीचा तुमचा त्रास कसा होता?
जास्त होता ना.
हा.
जास्त म्हणजे मला असं गोळी नाही खाल्ली नसले तर
हा.
मला गोळ्यावानी व्हायचं.
बर.
आता म्हणजे हे औषध घेतल्यापासून मला एक दिवस गोळीची गरज लागली नाही.
बर.
असं झालं.
हा. ठीक आहे. ठीक आहे. काळजी टेन्शनचं कसं वाटतं ह्या 8 दिवसात? कसं
जरा
वाटतं
कमी
तुम्हाला?
वाटते ना.
कमी वाटते.
Now she has said something very important that
Okay.
previously she was taking tablets, antacids, and recently there was not need of any antacids. Okay. See, listen.
कसं
जरा
वाटतं
कमी
तुम्हाला?
वाटते ना.
कमी वाटते.
आणि ते व्हिडिओ आलेलाच नाही बघा मॅडम मला. तुम्ही पाठवलेलं का नाही
हा.
तर व्हिडिओ आलेलाच नाही.
So actually, so Dr. Sonali has told me that she has sent some motivational video, which is she hasn't received, that she was talking about. So all in all, you can see this is a really encouraging video. Okay, this is some different slide. So I'll go to the first one. Sonali, are you there?
Yes, sir.
Really good work. Now I'll share
Thank
the
you, sir.
recent session, recent PPT. This is a recent one, right?
Yes, yes.
Which you have made the changes.
Final remedy.
Final remedy. After final remedy, there was video.
Before that, this is I think old one.
This is old one. Okay, okay.
Yes, yes.
Just a minute. Hello everyone. If are you all there? So if you are there, please let me in the chat box. Amazing to see more than 30 people here. I want your analysis if you are with us, and your remedy, please. Meanwhile, I will start the PPT once again. Okay,
Yes. Yes.
please, participant 35 people. Can you guess some answer, please? Okay, I'll take a 1 minute break for you to welcome Mr. Andrew Berwis from UK, a respected personality. Very happy to have you here, sir. We are discussing one interesting case. Welcome, sir. Okay, so Sonali, can you tell, have you written the totality?
Yes, sir.
So next
slide, sir, please. Yes, sir.
next
I
slide.
have taken the following rubrics for the
Yes,
repetization.
please tell orally the rubrics.
Yes, sir. In this case, main complaint is vomiting. So I had taken the vomiting of food, that is regurgitation, elements from cares and worries, then anxiety about son, anxiety about her own health, then dryness of mouth and dryness of nose, aggravation from bread, aversion for fatty food, and desire for cold things. These are the main rubrics I have taken for the repetization.
Yes. So everyone, do you have any remedy suggestion? I know this information is you need more time. Okay. What about
actually someone, Dr. Mauli is asking about the thirst of the patient. Patient is thirsty and also there is the dryness of mouth and patient feels mainly thirsty at night.
Okay. So yes, we will go to the remedy part. And Dr. Sonali, I'm going to next slide. Can you tell what is the remedy?
Yes, sir. I have given the Natromur 30 for this patient.
Okay. So with Natromur 30, the amazing response that we have seen, is it only single remedy or you have given some 2 remedies morning,
No,
night?
sir. I have given a single remedy, that is Natromur, with 30 potency in frequent repetition. When there are complaints, if vomiting, pain in abdomen, then I have told to repeat the remedy.
Very good. Okay. So this is all about classical homeopathy that we are talking about. This is a protocol, Dr. Sonali. How frequently you have given medicine? Can you tell everyone?
Yes, sir. If the patient had 1 to 2 episodes of vomiting in a day, the patient had to take the medicine 2 times a day. Means if there is episode of any complaint, it may be sleeplessness, may be vomiting, or may be pain in abdomen. At least 2 to 3 times a day, she had to take the medicine.
Okay.
After 3 to 4 days, as the frequency or intensity of the complaints get reduced, the repetition of the medicine or the dose gets reduced.
So this is a big topic, potency, but in our group that is inspired from Dr. Nikam sir's teaching, we use 30 potency and it works well. There can be many questions like water dose, LM potency. Dr. Patil madam, surely we will spare some time for this but we have 2 speakers in a row. So I hope you will take most advantage of that. But for here, Natromur 30 was all that work well. Okay. So here is analysis from Dr. Sonali. Dr. Sonali, can you explain quickly this repetition?
Yes, sir. I have taken the following rubrics, which is anxiety, health about, which is from the complete repertory. Then anxiety, children's about his, indisposed to talk, desires to be silent, that is taciturn, elements from cares and worries. Then eructation, food regurgitation. Then pain, dull aching, eating after, vomiting sour, vomiting of food, food and drinks, fat and rich food aversion, food and drinks, farinaceous food, starchy food aggravation, then food and drinks, bread aggravation, which is main striking feature of the case, then dryness of nose, and desires for the cold drinks. These are the rubrics.
That's really excellent. Then I think you have some words about natrum mur. Okay. Before that, let me tell you, most of the cases respond beautifully to the polycrest, the way in which we are practicing and the way in which we expect everyone who are learning classical homeopathy. Polycrest remedy, well-proved remedy, are many times more than enough to handle most part of practice. I'm not saying all part of practice. Dr. Sonali has worked with us in our clinic. Then she has put her own efforts and now practicing successfully, stably as a independent homeopath. Okay. Now this is an achievement and this is possible because of simple classical method that we are teaching and of course her effort. So last point she want to add about some points, some information about natrum mur for Philip Bailey. Sonali, can you tell please?
Yes, sir. Natrum basically, the key point is the suppression of the emotional pain.
Okay.
Emotional pain, that is the center of natrum mood, which originates in the childhood when the unconditional love from the parents, which doesn't receive. Natrum mood is the commonest constitutional type. The patients are introverted and hide their feelings, hate sympathy and avoid company. Latrums are so good at disguising. Disguising means to hide their feelings or emotions and their inner pain. So no remedy type is as often and as easily missed as natrum. So because of this hiding nature, we can't recognize easily natrum. This is all about the natrum.
Everyone who comes in our clinic, in my clinic, we request them, we ask them as a part of homework. Just a minute. We ask them as a part of homework to study the first page of Philip Bailey very thoroughly. We literally ask them to write down the first page of Philip Bailey. He has given beautifully natrum mur. Because there are so many natrum mur, I remember what he has given, that natrum mur is the commonest type, yet most easily missed type. And he has given reason 1, 2, 3, 4 why natrum mur is easily missed by many homeopaths. Now, first reason what he has given is, what I can recall here is that many times we feel that this is very normal behavior because the homeopath himself can be an natrum or has some shades of natrum. So the thing which is actually, for example, many of you students are living at hostel. Now you get call from your home. Just a minute. Let me tell you that this meeting can break in few minutes. Immediately join again on the same link as we are doing since COVID. So I think no need to tell you, but still, okay. Now I was telling about natrum. You are living in hostel as a student and you get call from your parents. How is your health? Have you taken food? Though your health is not good, though you might not have taken proper food, what do you say? Yes, I have taken it. So this is a new society where we care, we compensate our emotion, right? That others should not get hurt, others should not get disturbed, and that's why this natrum psychology becomes common. In the Philip Bailey, he has given you n number of themes like rebellious natrum, like clinging children, clinging parents, then joker, like a snob, those who makes other laugh but weeping inside, like Charlie Chaplin. Then there is positivity. There are n number of themes. Philip Bailey book only has few remedies, but I think almost might be 100 pages might be devoted to natrum alone. So today's excellent presentation of Sonali, I heartily congratulate her. And the takeaway message: take physical, take mental together. As in this case, physically she has a dryness, she has a gastric pathology. Any other physical points, Sonali, you want to tell?
Yes. Basically, main point is the thermals should be considered. That is, patient is hot and there is a dryness of nose and mouth. When some symptom comes in more than one organ, then we have to take it as a peculiar symptom. Okay, because there is patient dryness of nose also and dryness of mouth also. So I have taken that rubric, dryness. Then desire, aversions, and food aggravation, which is aggravation by bread, which is peculiar in this case.
Yes.
Yes.
Okay. Excellent presentation, Sonali. From everyone, I will congratulate you for this is your very first presentation I know online, but she's also working in the civil hospital Kolhapur, right?
Yes, sir. Yes.
Okay. So keep it up. And in upcoming days, I hope we can see more and more such cases classically, and let's grow together. Okay. So now, in 30 seconds, anyone want to have any comment? Quick comment, or I will go to the next speaker, Dr. Dhanasri. Okay. I will unpin you and pin Dr. Dhanasri.
Yes, sir.
So we will take 1 minute break automatically because of this Zoom setting. Okay. I think, yes. So some word of cheer from Dr. Shembekar Madam, Shilpa Patil Madam, and Dr. Ranka Chaya that are very precious to us, because see, we have put a lot of effort. Documenting a single case is very time consuming thing. You can imagine. Okay. That is so thoroughly documented. Now we will move to the next case with Dr. Dhanasri. Most of you might be knowing that she is my better half, practicing independently since last more than